general practitioner. Also called a family physician, this doctor is usually the first person someone sees when something feels off. Their training covers a broad range of conditions rather than one narrow area, which lets them treat everything from a common cold to early signs of diabetes. When a problem needs deeper attention, they are the ones who send a patient toward the right specialist. Their value lies in continuity, since they often know a patient's history over many years. Pediatrician. This specialist focuses entirely on children, from newborns through the teenage years. Kids are not simply small adults, and their bodies respond to illness and medication differently, so pediatric training centers on growth, development, and age-specific care. A pediatrician tracks vaccination schedules, developmental milestones, and childhood illnesses that rarely appear in adults. Parents often build a long relationship with one pediatrician throughout their child's upbringing. Cardiologist. This doctor studies the heart and the blood vessels connected to it. Chest pain, high blood pressure, and irregular heartbeats fall under their care, along with conditions like heart failure or clogged arteries. Cardiology grew rapidly once. Tools like the EKG and later echocardiograms made it possible to see the heart's activity without surgery. Many people meet a cardiologist only after a scare, though preventive visits are increasingly common for those with family history of heart disease. Dermatologist. This specialist deals with the skin, hair, and nails. Their work ranges from treating acne and eczema to catching early signs of skin cancer, which makes regular mole checks part of their routine. Skin often reveals internal problems before other symptoms show up, so dermatologists sometimes catch clues to conditions elsewhere in the body. Cosmetic procedures, though a smaller part of the field historically, have become a growing area of their practice. Neurologist. This doctor treats disorders of the brain, spinal cord, and nerves. Conditions like epilepsy, migraines, strokes, and Parkinson's disease all fall within their scope. Because the nervous system controls so much of the body, symptoms can be strange and hard to pin down, from numbness to memory loss to sudden weakness. Neurologists rely heavily on imaging and nerve testing to figure out exactly where in the system something has gone wrong. Psychiatrist. Unlike a psychiatrist is a medical doctor who can prescribe medication for mental health conditions. Depression, anxiety, bipolar disorder, and schizophrenia are among the conditions they treat, often combining medication with therapy referrals. The field has changed enormously since the mid-20th century, moving away from institutional care toward outpatient treatment and a better understanding of brain chemistry. Their work sits at the intersection of biology and behavior in a way few other specialties do. Orthopedic surgeon. This doctor treats the bones, joints, muscles, and ligaments. Broken bones, torn ligaments, and joint replacements like hip or knee surgery are common parts of their work. Sports injuries also send many patients their way, since twisted knees and dislocated shoulders need precise repair to heal properly. Orthopedics blends surgical skill with a deep knowledge of how the body moves and bears weight. Ophthalmologist. This specialist focuses on the eyes, handling everything from vision correction to complex eye surgery. Cataracts, glaucoma, and retinal disease are core parts of their practice, and unlike an optometrist, they are qualified to perform surgery. Eye health can also hint at broader issues, since diabetes and high blood pressure both leave visible marks on the retina. Their exams often catch systemic disease before a patient notices any other symptom. Otolaryngologist. Commonly known as an ENT, this doctor treats the ear, nose, and throat. Chronic sinus problems, hearing loss, and issues with the vocal cords all fall into their care, along with sleep-related breathing problems like severe snoring. The ear, nose, and throat are closely connected passageways, which is part of why one specialist covers all three rather than splitting them apart. Their patients range from small children with ear infections to adults with voice disorders. Gastroenterologist. This doctor manages the digestive system from the esophagus down to the intestines. Acid reflux, ulcers, irritable bowel syndrome, and liver disease are typical concerns they address. Colonoscopies and endoscopies, tools that let them see directly inside the digestive tract, are central to how they diagnose problems that blood tests alone cannot reveal. Because digestion affects nearly every part of daily life, their patients often deal with long-term, manageable conditions rather than one-time fixes. Endocrinologist. This specialist treats the glands that produce hormones, including the thyroid, pancreas, and adrenal glands. Diabetes is perhaps the most common condition under their care, but they also handle thyroid disorders, growth issues, and hormonal imbalances that affect metabolism. Hormones influence energy, mood, and weight in subtle ways, so patients sometimes see an endocrinologist after months of vague symptoms that other doctors could not fully explain. Pulmonologist. This doctor focuses on the lungs and the respiratory system as a whole. Asthma, chronic obstructive pulmonary disease, and pneumonia are frequent reasons patients are referred to them, along with sleep apnea in some cases. Breathing tests and imaging of the chest help them measure how well the lungs are functioning over time. Their role became especially visible during widespread respiratory illnesses, when lung capacity and oxygen levels became a matter of daily concern for many people. Nephrologist. This specialist treats the kidneys, managing conditions like chronic kidney disease, kidney stones, and complications from high blood pressure or diabetes that affect kidney function. When kidneys fail, nephrologists oversee treatments like dialysis, which filters the blood artificially. Because the kidneys quietly regulate fluid balance and remove waste, damage can progress for years before symptoms appear, making early detection one of the more difficult parts of this field. Urologist. This doctor handles the urinary tract in both men and women, along with the male reproductive system. Kidney stones, bladder issues, and prostate conditions are common reasons for a visit, and urologists often perform both medical and surgical treatment for these problems. Prostate health in particular becomes a bigger focus as men age, making regular screening a routine part of the specialty. Gynecologist. This specialist focuses on the female reproductive system, covering everything from routine screenings to fertility concerns and childbirth in cases where the doctor also practices obstetrics. Many women see a gynecologist regularly throughout adulthood for preventive care, not only when something feels wrong. The field has expanded well beyond reproduction alone, now addressing hormonal health and long-term wellness at different life stages. Oncologist. This doctor treats cancer, though the field branches into medical, surgical, and radiation oncology depending on the type of treatment involved. Chemotherapy, targeted drug therapy, and coordinating care across other specialists are all part of their responsibility. Oncology has changed dramatically over the past few decades, as treatments have shifted from broad, harsh therapies toward options tailored to the specific genetics of a patient's tumor. Radiologist. This specialist reads and interprets medical images, like X-rays, CT scans, and MRIs, rather than treating patients directly in most cases. Their diagnosis often shapes what the next doctor decides to do, making them a quiet but essential part of nearly every diagnosis involving internal injury or disease. Some radiologists also perform image-guided procedures, using scans to guide needles or instruments precisely to the right spot inside the body. Anesthesiologist. This doctor manages pain and consciousness during surgery, monitoring a patient's vital signs closely while they are unable to respond for themselves. Their job requires calculating exact drug dosages based on a patient's weight, age, and health conditions, since too little anesthesia risks awareness during surgery and too much carries its own dangers. Beyond the operating room, many anesthesiologists also manage chronic pain in patients outside of surgical settings. Pathologist. This specialist examines tissue, blood, and other samples in a laboratory to diagnose disease, often without ever meeting the patient directly. Biopsies sent for cancer testing, for instance, pass through a pathologist's hands before a diagnosis is confirmed. Their work happens largely behind the scenes, yet it forms the scientific backbone for decisions made by nearly every other specialist on this list. Rheumatologist. This doctor treats disorders of the joints, muscles, and immune system, including arthritis, lupus, and other autoimmune conditions. These illnesses often involve the body's immune system mistakenly attacking its own tissue, which makes diagnosis complex and sometimes slow. Rheumatologists rely on a mix of blood tests, imaging, and careful symptom tracking to identify conditions that can otherwise be mistaken for simple aches and fatigue.